Just a few years ago, Barnet and Chase Farm Hospital's NHS Trust was one of the worst performing trusts in England. It's now one of the best. This remarkable turnaround has been achieved with the help of the QFI-Jonah approach, which is based on the theory of constraints and identifies those areas that are truly limiting the performance of the whole system, and then makes changes so that a breakthrough in performance is achieved. It's not uncommon for the QFI approach to identify system-wide constraints that are caused by long-established policies or ways of doing things that are now damaging performance. Because the QFI approach addresses the underlying constraints of the system, significant results are achieved quickly and deliver better and more timely patient care.
From a management perspective, what they're pleased about is not only we're improving quality of care, but we're also managing to treat more patients within the same level of resources. And what this enables them to do is then to improve the financial performance of the hospital as a whole.
At Barnet and Chase Farm, just 6 months after introducing the QFI discharge approach, length of stay was reduced by a third, enabling the trust to dramatically improve the patient experience.
What it actually does for patients is to make sure that they get treated in an appropriate, timely, logical sequence. And therefore the added benefit is that they spend less time in hospital and they spend less time waiting for those interventions.
As head of site operations, Debbie Donnelly knows just how important efficiency is. She believes the QFI discharge approach is helping clinical staff use their professional judgment to discharge patients more efficiently.
We can really clearly see now where our delays are, and we can tackle each issue as it happens. The system is live, so we can look at it on a daily basis, and we can understand where the blocks are and address them rapidly.
Thanks to the QFI approach, patient services have improved dramatically here, and the trust has now been named as one of the 13 most improved NHS trusts in the country. Barnet and Chase Farm was one of the first trusts to adopt the QFI approach and is now paving the way for other healthcare organisations, including the community hospitals of Derbyshire Community Health Services.
We could all see that this would make a real difference to patients, and that's why we're all in the job in the first place. And actually it made a very positive difference to staff's working lives as well, and so you've got a win-win.
Just 2 months after introducing QFI-Jonah, the community hospitals in Derbyshire had reduced their length of stay by half and were able to return more than £2.5 million to the commissioners.
From a patient's perspective, it's improved the quality of their care. From a nursing perspective and a therapy perspective, it's improved their job satisfaction, able to manage patients in a more proactive, timely way. And from an organisational, it's given us more credibility.
The QFI approach is helping hospitals in Britain and abroad achieve a sustainable breakthrough in performance.
We've applied this in acute hospitals and community hospitals in a number of countries, and in our view there is no reason why it cannot work in any environment in a healthcare situation.
Delivering high quality care for more patients with fewer resources is a challenge, but thanks to the QFI-Jonah approach it can be achieved, improving the quality of each patient's care, experience and clinical outcome, and promoting clinical excellence and cross-services working within the healthcare sector, transforming productivity and generating immediate financial benefit.